for it. And I know that many of the doctors that are part of this group have had issues with Medicare billing. But Medicare at this point, as something that I explained to Lee, was that Medicare, every state has different rules, and that's number one. Plus, every state requires different rules and regulations. So I just want to make sure that everybody understands that because guaranteeing anybody Medicare billing is not an option at this point unless you follow the exact rules, A, within the federal government, and B, within the world of Medicare in that state. So it's all on the state basis. We work with you to allow success. We constantly are training our doctors, even if we're doing the billing, because without your documentation and ability to understand what's needed for medical billing, you can't be successful. So we already know that, and we let you know when we see something that you're not giving us or that we don't understand so that we could actually help you learn as you go on all of the different issues you are required to do to be able to medical bill. Nobody but you should be billing for medical unless we have certain criteria. One of the criteria is to know more about the patient than we have ever known. We need to know if this patient has any diseases or autoimmune diseases or systemic infections beyond a regular everyday cold. Okay, patients that are diabetic, we need to know what kind of diabetes. That means that the doctors, the dentists that are doing this are responsible for working with the medical providers and getting medical history from the patient's medical doctor, because there is no way to understand why this patient is a medical necessity without the required information. This is why we're able to bill medical more and more because of the connection to the body that everybody has. That we are now seeing that without the oral cavity kept clean, healthy, and functional, and that's a big word, function. If they can't function properly, they can't nutrition properly, and they have issues in their body that relates to the oral cavity, that makes them a medical necessity. So I use this pictures and other pictures with my patients to show how many different things are related to the oral cavity because we need to know what's related to the oral cavity. So the first form we need from you, and we supply all the forms, is a patient intake form. The medical history, and that medical history even has been updated by the ADA because the CMS requirement was to gather medical information. So we are responsible for that medical form. We need to make sure that our patients are filling out that form and actually answering every single question individually, not on the top of the paper with a line down. So we have to make sure that we need to know every medication they're taking or what they did take that could cause dry mouth, GERD's disease, or any other issues concerning the saliva in their oral cavity and what it's doing to their oral cavity. And the necessary information from a medical provider, which I'll show you more and more through this, that you collaborate with because he's going to need you and you need them. And that's just a fact. This is the updated ADA claim form. And if you notice it, there's more medical on it than there is dental information. And the reason for that is because all of these things are now related to the oral cavity. You can go to the ADA website and download this form. They do charge for it, but my recommendation is to get it. This is a way of me making sure that you have the documentation necessary for patients to be able to get medical billing and for you to be able to get that information. So the subjective, what is the patient telling the front desk when they're making this appointment? What is it? So the patient is saying why they're calling, or we should be asking why they're calling, and we should be getting all of this information right over the phone so that we can help you understand why this patient is coming in. When your administrative team can actually then get the paperwork from the medical doctor so that you have their diagnostic codes and their medical issues so that by the time they come in, if you have, for instance, a CBCT scan that you want to take, you got to pre-verify that. It could be done just with this information. You can also make sure that if the oral saliva is used and many other different tests, diagnostic tests that need to be done are done in your history. Your assistant can do a lot of this, the vital signs, extraoral if you take pictures, intraoral if you have an intraoral camera that you want her to take. Any x-rays you order can be done, and then any laboratory and diagnostic tests that you want done. And this is by your order after you read this first part, before the patient even comes in the door. This way, your front has the ability to pre-authorize any one of these things, if needed, to be able to do the first visit. The assessment, oh, that's where the doctor comes in. Your periodontal assistant. Hello? Your periodontal evaluation is very important for anything you're doing in the oral cavity. We must have charting. We must have readable x-rays. If you're using a CBCT scan, it should be read by a radiologist, so it's documented. If not, my recommendation is to use AI if you have the ability to get AI x-rays. They are been reading AI now, all the insurance companies for a while, so they're very informative. However, medical does not take x-rays, but you can document from the x-rays what you see. So you need to order them and you need to document what you see in those x-rays. And then what is your treatment plan for your diagnoses? What are your diagnoses? Are you going to look for another referral? Are you going to collaborate with that medical doctor, which I really recommend? Medications, you need to check them with him. And if you need to put the patient on any medications, we should collaborate in that sense. For instance, oral DNA will actually give you a report that states if they need an oral antibiotic that helps them with their infections in their oral cavity. So we really need to have all this. We give you every form that you're seeing here so that you have the ability to just use a checklist to make sure it's in your documentation. So at the end, you're covered on malpractice, you're covered on risk for billing, and you're covered on any other issue that could come up because everything is then documented. This is a website that you can go to, and I'm going to open it up so that you could see what I'm talking about. But can you let me stop share and then share again because I want you to see this website. Okay, so this is a medical website. that you can utilize to see how they are working with us and how they're learning how to get medical clearance for many different procedures. And as a group, a practice, you should contact some of the medical providers within your area so that you can set this up, so that you could even show them the website they go to and everything in it, so that when you open this up, you can really, really see what is going on. And this is, again, let me stop and open it up again. So let me know when you could see the whole website. Okay, so this is a website they're learning on, and it's called Medical Clearance for Common Dental Procedures. Why are they learning this? So they could refer to us. But we also have to let them know that we want to work with them. So just as an example, elective dental care should be avoided, except, for certain things. And then you go to oral and dental connections, and I got to stop and share again because we're online, but that's not a problem. So you could see here that they are learning all about the common tongue condition, salivary glands, screening and preventive intervention for oral health and children, or manifestations of systemic diseases. Should they have an entire website that is showing them what we must be looking at and learning to work with them on? Are there any questions in looking at this? Is anybody on this, or are you just recording it? Hello?
Can you go back a couple pages?
Who is this?
This is Dr. Huang.
Okay, and Doctor, what was the question?
Can you go back a couple pages?
Oh, so you could read it.
Right.
So can you see this now? Can you
Yeah.
see the
Yes.
screen?
Yes. Thank you.
Okay, so they're learning about the oral manifestations of the systemic disease, and we are learning it. So we have to work together. Severe periodontal inflammational bleeding should prompt investigation of conditions such as diabetes, human viruses, infections, all of the things that we can see even before them. So if we have a patient coming in to our practice, even if they were not referred by their medical doctor, and they have red puppy gums and they have bleeding, 90% of those patients have some kind of systemic infection. So that's why we use oral DNA and saliva testing, because it will back us up. It will help us make them a medical necessity. And this comes right on their site. So I'm giving you the website so you could explore it on your own and really look at all of the different things: periodontal bleeding and inflammation, dental erosion, mucosal changes. A lot of those things guide us to know there's something going on, but we are now responsible for helping the patient find out. If they didn't give you a medical reason and you can't get a medical doctor, then how do you know for sure? Because we can't diagnose diabetes or lupus or any of those things. So I know some of you have started doing billing for sleep apnea. So you already know that you can't diagnose sleep, but you could treat it. So I want you to think about this for bone grafting, for implants, for any of the treatment you're doing. If we see something in the oral cavity, some of the things that we need to know are about the body and not the oral cavity, and vice versa. Does everybody get that? Does that help, doctor?
Yes. Thank you.
So you'll see this website right here, and I'll go back to you could you could see, I'm gonna put it back up so you could see it right here. See, common dental procedures. And what you can say, it's the American Academy of Family Practitioners has all of this online, medical clearance, everything. So you can really get a lot of information just from that site in helping you diagnose patients better, not just, oh, they have caries, lesions, but they have, you back it up with their medical condition when you're billing. And that's what we do for you. Okay. This is a predetermination form. So if you want to do your own verification of medical, if that's something you choose to do, this is what you need to have, whether we do it or whether you do it. So we need all this information, plus a photocopy of the front and back of the patient's medical card, plus whatever information whoever is doing the verification, we take a lot of information so that you have it and we have it. Who did we speak to? What number was it? The name of the rep, the time of the pre-authorization call, and the call confirmation number, authorization number, if we got that. Is it done or is it pending so we could follow up on it? And was it approved? And then the clinicals and documentation. Where are you sending it to us? Do we have to go into your computer to get it? It's better for you to send us everything at one time, if that's something you could do, because we're supplying you with the forms, so you could just fill them out and send them. So if you do this in your office and don't have a billing company do it, you can do it and then just send us the filled out form so that we have it to follow up on. You must have your patients sign this form, the medical records release, so that we could speak to the medical doctor in the patient's absence. Uh, and we can do that for you also, if you want, so that we could get the medical records and the information that's needed to back up your medical claim in the billing process. We want to know about anything that he had. What's the progress of the patient's illness? Any diagnostics that we should know about? Any x-rays we should know about? Anything that is important for us to know, so that your medical record then becomes medical necessity. We do need, before we do anything, and we tell this to every provider, you cannot have two be scheduled, one for billing dental and one for billing medical. If you're going to bill medical, then we need to look at your fees, and those are the fees that we're going to use. So we'll tell you what fees we need after you fill out forms or paperwork, telling us what you're interested in billing. If you're billing sleep, what do you want to charge for that? If you're billing bone grafts, what type of bone grafts, and the codes that go along with it, you could just use the dental codes. We'll do the rest of the billing to make it medical, but we can then put those fees with those treatments so that we're compliant and legal, and there's no question that you sent in this form with this set of fees and then another patient with another set of fees. We don't want to do that. We have a business associate form that you would have to sign. And we also recommend downloading this computer program, which is free, absolutely free. It's also billable. So what you're doing is having the patients fill this out so that you can put in a risk assessment. The medical world uses risks. They're either low risk, moderate risk, or high risk. And when they're moderate or high, that gives them a medical necessity towards their treatment in your practice. So it's really about making sure we have all this information. And this is a free program that you're able to download and put on every computer in your office so that the patients could fill it out before they're seen. So we have that extra information. You should always know that pictures tell your patient a lot more than anything we could say. Now, granted, I'm sure you have patients that need things translated, but anything could be translated online today. And then this picture I use because really doesn't have a mouth with teeth. And every time I put this picture on a patient's lap, they ask me, why am I giving them that picture? It has no teeth. And I tell them, we now are responsible for making sure that whatever's going on in your oral cavity, we're looking on how it's affecting the rest of your body. So I hope that helps you understand why we need this information. And these things tell the patient. So respiratory disease, it's the third most common cause of death. And dental plaque harbors a high number of respiratory pathogens that can be aspirated and in turn increase the risk in susceptible patients, patients that have already a compromised body, that have any kind of pneumonia, emphysema, chronic obstruction, patients that have asthma and use a pump. It's just an amazing discovery, and it really is very hard to find every one of these codes. So we don't want to get those codes. We want these codes to come from the medical doctor so that we could use their name in saying they have said this is what the patient's being treated for. Therefore, your information on the plaque that the patient has, or the need for bone, or the need for implants for chewing and swallowing and function, is a medical necessity. So we have a lot of tools, but saliva is one of the biggest tools that we have, and it's not used enough as far as I'm concerned. We really have a lot of fungal infections, viral infections that are undiagnosed. So we can do all this work and the patient still has it. And then they come back a year later with all of the same issues because we're not testing and documenting we tested and then gave them more information on how do we keep them healthy? How do we make sure that they have the ability to stay healthy? And just so you know, dental plans are looking at this, and dental plans have added additional hygiene visits for every one of these patients that are dealing with any one of these issues, any kind of lupus, arthritis, diabetes, millions of different things, so that you're not just taking care of the big work, but you're keeping them in your office on a 3-month basis so you could protect the work that you did before you even place any new work so that it stays healthy. So saliva, this test can really help. It's a meter test, or you could use oral DNA, that's fine. But medications dry the oral cavity. There's no saliva. We have a lot of breakdown because of that. And we also know that too much saliva also causes issues. So, like patients with certain mental issues have more problems with the amount of saliva they have. Burning mouth syndrome from certain cancer treatment or any dry mouth patient can get burning mouth syndrome where their tongue feels like it's on fire, and that we can actually use, according to the AAP, uh, how oral health might reveal cervical cancer risks. So we have a lot to learn in this field, but this is a lot of the information right here. And I will, once you sign up, we get you a free kit from Carrie's, free screening, so that you could try out their products. And if you want the meter and saliva testing, you could become one of their clients and they will offer you discounts. But there's so many other things.
Can I ask you a question?
Yes,
Um,
absolutely.
about the saliva test. So the company that can do the saliva test is called Carries, and
Carrie, Carrie's free, and I'll give you their website before we end, okay?
Okay. Now,
And the
my
name
question.
of I want you to call this one person. Her name is Jenny, and she's gonna then sign you up and give you a free kit to start off with so that it helps you understand more about the product. It comes with a book about why this is so, all of these things that we're talking about. And then if you want the meter, then that you become a client and they will get you the meter and the saliva testing.
Gotcha. But
And- but you'll
is
get some free stuff too.
right? Is the saliva test billed to medical or dental insurance?
And the saliva test can be billed to whoever the medical insurance is, and dental insurance, believe it or not, does cover for those things. And oral DNA is billing. If you did a biopsy, for instance, I want you to think about oral saliva the same way of a biopsy. You
Mhm.
would take the thing and send it to a lab. The lab is billing the medical insurance because it's a biopsy. There is no
Um,
dental, right?
yeah, I'm currently working with oral DNA, and they do not bill any insurance, not dental, not medical. I'm not sure we're talking about the same company. They bill my office.
No, your company is not okay. Your office, what are you doing? Oral DNA?
Yeah, we're taking saliva tests, send it to oral DNA. That's the name of the lab, and they charge my office. They do not
Yeah,
bill
but
to.
we could bill if your billing company should have been billing that for you. Honestly, they bill for their part of it to the medical. If you send them the medical, I thought they did, but biopsies, oral DNA is billable. You have to wait though for the test to come back so you have a diagnosis on it and you're able to then bill it. Now, if you have a billing company, they can bill it. I don't know, were you using the billing company?
I'm not currently. We're billing this saliva test to patients' dental insurance currently, and but we're paying. The office is paying oral the lab, oral DNA lab cash.
Well, you have to buy the kit.
Yes.
Right. You're going to buy the kit. So when you get the results, if they're not billing for it, then you need to bill for the biopsy itself, the test itself, for your office because you collected the saliva. They can't do a
Mm-hmm.
test without the saliva, right?
Mm-hmm, mm-hmm.
So you would bill for the test results.
And that can be billed to medical.
Yes, absolutely.
Thank you.
Okay. And look at some of the codes here. Just out of curiosity, just so you could see. Um, patient is going for cancer treatment, but they have oral mucosis, ulcers in the oral cavity. That is backed up then with their whatever treatment they're having. Here's radiology. Okay, right.
Mm-hmm.
So we have codes that connect not only to what you're doing, so you could say, this patient has very severe GERD, and I did an oral DNA to see what's going on. You get the results back. This may be another code with it, or the medical doctor is giving you this code, or we're looking at this code. So we're using it. And look here, you see more right there. I don't know if you could see them with this in the way. Okay, so there's salivary glands also. So I don't know what you're seeing on the test, but I could tell you that those are billable because it is a medical test. You see all the diagnostic codes? There wouldn't be a diagnostic code if it wasn't a medical code.
Mm-hmm.
Okay, now um, just so you understand, we must document why we're doing the test, send it, or do the meter chair side. You do it yourself. If you see it's a high number,
GPT.
what? I'm sorry, I missed
Are
that.
you charging?
This is an oral DNA test. Is this what you're getting back from the oral DNA, doctor? Hello? Okay, well, I don't know. I'm just gonna say to you
No,
that
no, this is not looking exactly. We get a report back, but not exactly looking like this. But it is the same lab, and we're currently ordering HPV test.
okay, so I don't know what you're sending for, but this actually was my test.
Charging.
And just to give you an example, but you can see right here, they're recommending scaling and replaning to disrupt the film. The patient harbors a series of pathogens. It tells you exactly what pathogens. And we need antibiotics because this is necessary to use while we're doing this therapy so that we're killing the bacteria as we remove it. Now, remember that it does come back because that's the patient's health, but we have to have this kind of stuff along with our. You're not going to do bone grafts without knowing what is going to keep this patient healthy. Enough to get bone grafts, pay whatever you're
You're
charging.
gonna cut your hair, huh? After daddy?
Say that again. Can you say that again?
Christine, I think that doctor has some background talking in there from the family. Need to
Nobody.
mute the microphone.
Oh, well, I don't know. I'm sorry I'm hearing somebody, but this is
That's
a,
why you're hearing something.
I'm sorry. Um, but you can see how much information it gives you and the type of reasons that you're then able to be able to really see why the patient is a medical necessity. Does this help a little bit? So you could see if they're high risk right here when you look at the test result, moderate risk and then low risk. What are they at? And it gives it to you. Your test results show a genotype, which is categorized as high risk for periodontal inflammation. But arthritis, lupus, all those diseases are inflammation diseases. And when you have an inflammation disease, it's everywhere. It doesn't stop in one place. So doing a diabetic screening in the dental practice is also something we highly recommend if you're going to do medical billing. And the reason being is that we can't diagnose those patients, but then we can have them see the medical doctor because diabetes comes in 1,000 different diagnostic codes. And so we're just looking at an underlying condition, red puppy gums. We test it. The number shows us that we need to send them to a medical doctor for more testing so that we could get the exact results and use that for part of our medical billing needs. Just a little fun thing if you're using a CBCT scan, the reason they're so amazing, and this would be if you look here, the color of it, the AI part of it, but it is a billable in many ways. And you can bill even your intraoral complete series of radiographic images to medical, intraoral first radiograph, Panorac, Ceph, home beam, so on and so forth. You're not limited to not billing x-rays. We want you to bill x-rays. We need to look at the fluoride varnish. The medical world has made a code for it because we're not doing enough of it on patients that are coming in with a lot of loose teeth or root caries or even kids. And we need to start to talk about the fact that it's not a hereditary issue. In my culture, our families thought it was hereditary to lose teeth at a young age, but it's not hereditary. It's a transmittable disease and it affects everybody in the family, even drinking in a cup with the same two straws, you think you're safe, but you're not because the saliva is going back in. Or sharing a fork with cake. I also use these pictures as a reminder to patients why we're doing what we're doing and to see how much damage could be done. So, a diabetic patient, if they're that severe, they could lose a foot, they could lose their eyesight. Well, what makes us think that they can't die from the diabetes spreading through their saliva into their body? It's one of the biggest killers in our country right now is diabetes. Kidney disease, anybody with kidney disease is covered under Medicare for oral. Pregnant women are covered under oral care for care. Alzheimer's, dementia, heart disease, stroke, osteoporosis, and any like GERD's disease, stomach ulcers, all of that is a covered procedure. So we do bill periodontal inflammation and implants and bone grafts. And when you're billing a bone graft, for instance, and I teach at the AAID, the Implant Association, and I keep this because we have to be able to document if the patient has generalized, localized, slight bone loss, moderate bone loss, and severe bone loss. And so when we're not documenting that, we can't bill. We cannot bill anything without this information. Whether you're doing bone, whether you're doing perio, whether you're doing implants, it doesn't matter. We cannot bill without this information. And this information has to match atrophy. So if they have moderate bone loss apparent, how much atrophy do they have? It wouldn't make sense if you said severe atrophy if you don't see severe bone loss. So we have to have both. So you have to also look at, did the patient get injuries to the mouth by trauma or perio disease or caries, or is it something that's going on in their body that they have not had the care for, or they went for cancer treatment, had radiation and lost teeth, or they have other diseases that they just had extractions because they just were dealing with so many other things or had no money to deal with it. So we have to like know the reasons why they lost teeth, they have bone loss, and whatever else is going on. So the class set are again class 1, 2, 3, and 4. And maxillary and mandible are severely damaged from a current disease complication, but surgery on the patient is not possible. Alternate options must be considered. That's something that maybe you have to do in a hospital, but most of our doctors do class 3, and they have damage from current disease, complication, surgery on the patient must be performed so that dentures may fit properly, or you're all on 4, or whatever you're doing in your office. Bone grafts are covered more readily than even implants. I don't know if you were billing implants, but bone grafts are a necessary part of the body that you can't function without. So I use the example of a patient with a broken arm. If you break your arm and you're put in a cast in the medical world, they're going to take an x-ray to diagnose you. They're going to take an x-ray in between to see if it's responding to the treatment, whether it's casting, surgery and casting, it doesn't matter. And then they're going to x-ray it after they take the cast off to make sure that it looks good. But they also tell you in advance that you need rehab to rebuild the atrophy that you have because of that surgical procedure and that cast on your arm. You lose muscle. So we need to tell the patient the same thing. We do bone grafts. It's about the atrophy, and it's giving them lack of function. So if you have atrophy, even wearing a denture is not possible. That's why all on 4s and all on 6s are so popular today because they are fixed in. But keeping those implants healthy is the priority for those people so that we could keep the bone we're placing healthy. So if they were sick with perio, on top of all the other things, we have to clean them first, then do our surgical procedure bone graft, making sure it's healing, making sure it's done, and then do the implants and overdentures. Because without it, we're going to keep losing teeth, they're going to keep atrophying, and we're going to have no success in this field. Again, I'm just showing you the classification for again, partial loss of teeth without a reason. Partial loss of teeth to trauma, caries, or periodontal disease. This has to come from your charting and your x-rays, and that's fact. If it's trauma, they need to bring you specific information from either a hospital, ambulance ride, or however, wherever they had the accident. If not, we're not able to bill it without taking on the issue. We give you a sheet like this with all the codes of whatever you're going to be billing. And there's also room so you could add more information. If we think you're picking the wrong codes, we'll call you. We can't pick codes for you, but we'll call you to go over, this doesn't match this documentation, or we need more information on how did they lose the teeth and why is it partial when they have no teeth. I mean, so we really will teach you almost every day whenever you're billing. So any questions? I
Uh,
mean, there are any
Doctor,
questions listed?
yeah, Dr. Texin. My question is that such like implant or bone graft, when you bill both the dental insurance and medical insurance, so
I'm
and both
really having a hard time hearing you. I'm so sorry, but could you speak
louder.
again?
Okay, yeah. So right now you mentioned that we can bill both to the dental insurance and the medical insurance.
Yeah.
So if both the insurance paid, so is it legal for us to get the payment from both insurance for one treatment? Is that legal?
No, billing is a billing, and I'll show you. So I want to show you something that I have. I think it'll explain it better.
Mhm.
So let me just show you so that you could understand the complications of billing. Okay.
Got that.
Hold on just 1 second. I want to share this screen. Tell me when you could see it. Can you see
I
it?
can see that. Yes.
Okay. This is a calculator.
We can see it.
Okay, good. This is a calculator. A patient could have 4 insurances. Okay. They have double coverage, dental, medical. Their husband has dental,
Got
medical.
that.
The
I can
rule
see that.
the rule of billing, the
Mhm.
rules of billing
Mhm.
are that if your fee, if you
Mhm.
look here on the top, the fee, full fee, that's the patient what you bill is always your full fee,
Mhm.
never the insurance fee. So the full fee is $2,190.
Mhm.
However, you are in network or you
Right.
have some non-covered services. So the doctor is contracted with one or more plans.
Mhm.
So that means that you can't accept more than 1623. So
Got
I don't recommend billing dental first
Mhm.
because if you're in network with them, then you can't collect the higher fee from the insurance, the
Right.
medical. But if you collect the higher fee in the medical,
Mhm.
you could bill maybe 1 or 2 things that weren't covered in the medical that we could get billed and get covered for in the dental. That's how we teach. We also keep record of what did your first dental insurance pay? What did your second insurance pay? What did your first? So we make sure that you don't go above the contracted allowable fee if you were in network, or the full fee if you're not in any network. Does that help a little bit?
Got it. I see. I understand now. Yeah. So, if in this example, if the treatment in different dental insurance and the medical, such as this one, if for one treatment I did, so maybe can I just select the medical insurance number one? I just accept this one instead of the dental insurance and the medical insurance number two to get
Yep.
the highest one.
Yep.
Is it right?
Then we go to dental. You
Got
know,
it.
my husband is a dentist.
Mhm.
And when I started billing medical, like, I don't know, 25 years ago,
Mhm.
when we started, it was about TMD, temporal mandibular disorders, right?
Right.
We charged a set fee,
Mhm.
okay, for all the services that went into making the appliance for that patient. Okay. What we did is we would bill medical first. Medical would say X, Y, and Z is going to go to the deductible. So now I'm going to bill dental for the X, Y, and Z because it's better to get something than nothing, right?
Right.
Okay, so now we ate up the deductible with the little things that we could get covered on from the dental. So whatever the dental paid, the patient, if we were not in network, the patient still had to pay co-payments and deductibles. So that's a law, and we don't break those laws. So we just collected that. So instead of them having that big deductible that we had to work off, then we were able to collect something that they could put towards that big deductible. Does that make sense?
Mhm.
So that they're collecting something, because if they have a $3,000 deductible
Mhm.
and they don't cover 3,000, we're going to bill that to dental. So now by the time you get to the big work, the actual bone grafts, the stent, all that other stuff, the x-ray, we have almost all of that deductible used up already from the medical, so that we're billing the higher level fees and we're getting payment. So that all they have then is that copayment. Everybody has copayments, whether you're Medicare or your regular insurance. I don't care what they are. Everybody has copayments and deductibles. So we have to look into that so that we understand it. And we would tell you this is what's covered. That's why we use that paper. Again, I'll share it again.
Mhm.
This is why we use this if you have multiple plans, so that you can see what's being paid, what's being covered, and who we're billing. Make sense?
You're right. Yeah, makes sense. Got that.
Like you could look here, this patient had 4 insurances paid towards their plan. However, all that was covered was $1,331. But
Right.
they have to pay the amount owed by the patient was $292 because we were billing $21.90. We're allowed to collect $16.23. So insurance paid $13.31. The patient had to pay the balance to fill in the $16.23. And then we had to write off $567. We don't write off unless we collected everything.
Mm.
You see what I'm saying? So the patient always wins in this scenario. They
Mm.
collected the most they could get
Yeah.
from all plans. Now, that doesn't mean they're not going to have a fee, as you could see here. But look, who gets $2,100 worth of anything for $292? Really?
Mm.
Okay. So, the patient has to look at it the way we're doing it is that they're benefiting. Now, I could tell you in our office, if we were billing medical and there was a big deductible, then we had them on a financial plan, legal one online. So there's two companies I work with, because you don't want to be the bank ever. So they borrow the set amount of money, say $1,000, but they pay it off. So before you even start, they're paying off the deductible. And as we're billing, we're collecting. So sometimes at the end, instead of them owing money, we may have to pay them back. But I'd rather pay them back than have to chase them for $292. I don't want to chase people for money. That makes bad juju, if you know what I mean. Asking for money after the work is done is bad, because patients feel like, well, you collected all this insurance money. You don't want to get in that kind of nitpicking with them. Does everybody understand that? We would help you with all this. This is something we help all the doctors that do the medical billing. Now, if you want to just learn it, then that's something I could teach you, but you have to do the work then. So that's a choice every doctor has to make.
Okay. Thank you,
And
Doctor.
I'm going to say something right here and now. We do have to charge, right? It's a business, but that doesn't mean that you can't, add in a charge for the actual billing. You could. We can't. But you could.
Got that.
So it is something to think about.
Yeah.
Any other questions?
Doctor, my second question is that right now, yes, when here another learner ask you about the oral DNA, or sometimes we do the oral biopsy, and so such like usually the physician, when the physician asks the patient to do some tests, they just schedule the appointment with the lab directly, and the patient go to the lab to get collect the sample, and then the patient pay to the lab directly, and though also the lab charge the insurance directly, so the insurance didn't send the bill to the dental office. So when I do the biopsy, if not biopsy, if the oral DNA, should I schedule the patient to the oral DNA company, ask the patient go to the company directly to collect the DNA there, and then give me the result? Or should I just collect the patient's sample in my office and ask and then pay the bill to the oral DNA from my office? So which way is better? I have no idea.
Well, I could tell you the thing with oral DNA is you have to have the package, so you have to buy it, right?
Right.
So they're going to bill. They do bill medical. I thought they did. So doctors saying they send other bill, but the bill you're paying is the purchase of that package. When you get that package, that's a fee that should go to the patient, because then the lab, when they do the work, when you send them that saliva, that lab work then goes to be billed to the medical plan for them to do the work. Okay?
Right.
You then get that back, that big form, and you then bill for the collection of the saliva. And you can't collect saliva without the kit.
Right.
Your fee is that kit.
Mm.
Your fee should be that kit. Now, that means that either you could charge the patient for that kit and send it to the lab, but the lab is charging you for that kit, and you can't get saliva done the way oral DNA does it without the saliva. They can't.
Right.
They have to have it in this special case. So in saying that, if you don't want to do that on every patient, my recommendation is to do the saliva test in the office chair side, and you could use that, and then you bill it to the insurance company the same way, because you're collecting the saliva and you're testing it, and it does tell you it's a meter, and it gives you the saliva pH level, which
Mhm.
shows whether the patient's saliva is sick or healthy, pretty
Got
much.
that. Okay,
And
yeah.
they send you a whole book on it and all the information and training along with it. So it's two choices here. I
Mhm.
always did the saliva chassis first. If
Mhm.
we saw that it was not good, then I
Mhm.
would do oral DNA on top of it. But I would tell the patient, listen, we can't restore you back to health until we know what we're dealing with as the infection,
Mhm.
because they have infections. And
Mhm.
some of the treatments we're doing, we know today that scaling and root planing only helps if we're killing the infection. So if
Mhm.
we're placing bone without cleaning, what good is it?
Mhm.
Right? I mean,
Right.
we have to kill it. So it's, think about it. If they already have an illness, they're more prone to another illness.
Mhm.
So
Um,
that's something that I could even get a webinar for everybody from Oral DNA if you'd like that. They will be happy to do that. I could set that up. And for the
um,
saliva person.
I have a question. As far as I know, currently there's no FDA approved saliva test tubes, um, including oral DNAs.
Okay.
That's the first question. And the second question is, does the oral DNA lab also do biopsy? For example, if we find cyst, um, bony lesion, and we operate it, we clean up the defect in the bone, we send it for biopsy. Does oral DNA also, because you mentioned about biopsy,
Yeah.
do they actually do biopsy?
Once you do a biopsy, it's the same thing with the saliva, and they send you results back, then you bill it to
Who
medical.
is they? Who is
You
they?
can't bill it without the test results. So you have to wait to bill it, but they usually will send the result pretty quickly.
So the oral DNA will actually do the biopsy?
I don't know if they do biopsies. I really don't know the answer to that, but there are
Hmm.
plenty of pathologists out there today, more and more dental pathologists out there. But I can try to find out who's could do the biopsy. See, you're all in different areas, right? Where are you located?
Yeah, we're all over the country.
Right. So it's really where you are, and then we could find out who could do those biopsies in your area. It's like there's choices of biopsies. A biopsy, the only real biopsy is a cut biopsy. And that billing is very specific. In other words, did you take it from the cheek, under the tongue, the top of the tongue, the roof of the mouth? I mean, where is the biopsy coming from? See, that's how much
Those
information is
those
needed.
informations are very well clearly marked on the order form as far as the location,
Yeah,
my diagnosis, and everything.
right.
Right now, what we have trouble with is finding a biopsy lab that will bill insurance instead of billing.
They're not going to do the billing. They just don't. You do the
Yeah,
billing. You could do the billing. Where are you located?
we're in Washington.
Washington State
Yep,
or Washington, D.C.?
state.
Okay. I'm actually doing a program next week or the week after in Oregon.
Mm,
And if you want, I'd be happy to sit with you when I'm there.
mm, mm, mm.
And I could find, I used to work up there a lot before COVID. And I still go to California too a lot. But I haven't been to Washington lately or Seattle, but I am going to be out there next week. And I mean, it's not that far, right?
Yeah, definitely let me know if you're in our area.
I'll send where I'm going to be to Lee, and then she could send it out to you because I don't, unless you send me your information and I'll send it directly to you.
You have my information. I sent you some documentations you have reviewed. Oh, we'll talk later.
Okay.
All right.
Okay. So does anybody else have questions before we end this call? And I gave you a lot to think about.
Did you said the saliva test can be billed to medical insurance
Yes.
and the dental insurance?
Well, some dentals don't pay for it. I always go
Okay.
to medical first. Medical
As
is
far as
for,
as far as I know, there's only one company that pays for the dental, the saliva test. Microsoft Primera pays for it.
Oh, okay.
you're in Primera on the West Coast, pays for
Yeah.
much more than any other Blue Cross anywhere.
Hmm.
Just so you
So-
know that.
So when you say medical insurance pays, does that include Medicare or only commercial?
Medicare is not your option. But
Okay.
I'm going to give you an example. I don't know who's speaking, but I'll give you an example. I have
Yeah.
Medicare, right?
Yeah.
I have
Uh-huh.
Medicare, primary, but I purchased a secondary insurance through United Healthcare to cover my drugs, my
Uh-huh.
anything, anything that was not covered under Medicare. Okay?
Uh-huh.
So I'm billing right now for myself because I'm in the middle of this work.
Uh-huh.
I'm billing for a cartilage graft. I'm billing for a removal, an implant removal, bone replacement, and something else. I forgot. But
Uh-huh.
I'm billing it to medical. Now I have to get a denial from Medicare because
Yeah.
they're not going to cover me. And I have illnesses. And
Uh-huh.
they're still not going to cover it. But
Yeah.
because every state is different. This
Uh-huh.
state is not covering it. The state
Uh-huh.
I'm in. So I get I put a special code on my Medicare plan and they just deny it. And then
Uh-huh.
they'll send it directly to my secondary,
Uh-huh.
which is a full plan. So
Uh-huh.
that's why you got to ask patients because Medicare is never going to cover, they don't even cover prescriptions. So 90% of your patients have more than one plan, or they're paying out of pocket for everything.
So you bill as a patient yourself?
Well, I mean, I'm billing for the office that did it because my son's office did it, but
Oh,
doing the
okay.
medical billing for
Okay.
myself because I know how to do it and they don't know how, so I'm doing it.
I see. Okay.
Can
Okay.
can I ask you where your son's practice is
Maryland.
located?
My son is in
Mhm.
Maryland.
Maryland. Oh, I see.
So, and people they worry about Medicare, but you know that Medicaid pays more in most states, pays
Mm-hmm.
for more treatment than Medicare. So that most Medicare patients today are
Yeah.
either getting a Medicare Advantage plan that's
Yeah.
say Humana or
Uh-huh.
the Blue Cross with dental in it.
Uh-huh.
That means you could tap both of those in one plan.
Okay.
So what you need to do, if you really want help, is
Yeah.
photocopy some of the insurances front and back that are coming in and make sure you're asking them if they have any other medical insurance. But if
Mm-hmm.
they're giving you a card that says Aetna,
Yeah.
but it's Medicare, that means they have medical within that plan because that plan is medical. They're just getting a dental plan along with it.
Mm-hmm.
So they're saying they're Medicare, but you may not be accessing all the benefits.
Okay.
So may I ask you, so do you have an Advantage plan? The procedures that you're billing for yourself or for your son's office, do you have an Advantage plan? Or do you have a Medicare and supplemental plan from United?
Right. No, I have a full secondary. I have a Medicare card and a full secondary.
The
Mm.
full secondary is a supplemental plan or Advantage?
No, it's not a supplement. Supplemental plans only cover what Medicare covers and the copayment. It does not cover anything else. A supplemental is like a waste of money, in my humble opinion, because you only get coverage for that $20 copayment or that. Well, we had $300 now on Medicare is the deductible about, but that's really a drop in the bucket. What if you're on medication? Who's going to cover that? You still got to get a plan for that. So when I decided it was cheaper for me to buy a full secondary than to get coverage for a supplement and then still have to buy prescription medicine. Does that make sense?
So
So
you
I
get
just
a
bought
full,
another plan.
you get a full plan, like a commercial.
A commercial plan, yes.
I see. I see.
And
Yeah,
that
so you
covers
have, in other
that
words, you
covers
have
my
to just-
prescription benefits, and that covers all of the things not payable by Medicare.
Got it.
But Medicare, because I have Medicare, I have to bill Medicare first. And then I'm telling them, don't pay it, send it to my secondary. That's what I'm doing.
I
Because
see.
the secondary won't pay it unless Medicare denies it.
Got it. Got it.
See what
Okay.
I'm saying?
It's
So
Yeah.
there's
my understanding, it's my understanding if Medicare denies it, the secondary, your PPO plan will deny as well.
No, not really. No. Medicare has so many things on it. I'm hoping, I belong on a lot of organizations. I'm really seeing that next year we're going to see more dental benefits, but it won't be until 2026 and then 2027. Because when you start giving so much money out for other things, there's no money for the Medicare. So I think you're going to see a big difference in 2 years. But I can't wait 2 years, so I'm doing it my way.
So you have a billing company, or you have a
Well,
team?
the billing company is really my husband's and a partner's, but I oversee the training and the billing and all of it. But I teach more. I'm really away a lot of weekends doing programs. I mean, I just taught at the Endo Society. I teach at the Implant Society. I
Uh-huh.
teach all over the country, all over. I've been to California twice this year.
Oh,
So,
when
and
are you
I,
going to be in California again? I'm in California.
yeah, I did a study club also for a group of doctors in California.
Uh-huh.
And 2 days, they rented a house and everybody traveled to that house. And we did a big study club. But I teach at CDA. I taught at Sacramento this year. So I do teach in California. I teach everywhere, really. Whoever invites me to speak, I go speak.
So
Yeah,
would you
Christian,
provide your billing company's information, post on the chat?
Say that again.
your billing company information.
Yeah.
Oh, yeah. So, I thought you have everything. You
I
don't have,
have everything. I can send
So
out
you
Or maybe
our WeChat group
Nina.
as well later.
yeah,
Okay.
so you could send them all that and send them my email if they have questions about what we talked about tonight.
Mhm.
Also the
And
saliva test information, the company.
I'm going to send, yeah, I'll give you that before we end. Where I'm going to give you the name of the girl that I want you to talk to so you can get the samples. And
Uh-huh.
it's a nice kit. So just give me 1 second because I got to get her phone number for you. Hold on.
Sure.
Okay. Thank
Feel
you.
free to post any information in WeChat.
And Lina, can
Huh?
you help post the contact information for Christian in the group?
What do you mean host of the contact? Posted the contact information. Yeah,
Yeah,
I can
and
post
her
it in our
about
WeChat
her.
group. I have all her contact information.
Okay.
Sorry, guys, I just ended another business meeting, and I am able to catch with this meeting.
You're busy.
And Lina, while
Mhm.
Christian is gone, so I'm understanding Christian is mostly doing the education part for the billing company. And we really didn't get much introduction as far as the billing company. We don't have.
Oh yeah, Christine.
Wow.
Christine is mostly engaging in the training part, and her husband Paul Texan is in charge of their billing
Billing company.
business.
Yeah.
Hey, I
Yeah.
can't do it all.
Right.
It's-
I'm gonna send everything up in our WeChat group. You just everybody just feel free to contact either Christine Texan or her husband Paul Texan. So
Okay.
Yeah, you could send both of the
training part.
emails. And I want to give them Jenny, and you should write this down for any of your doctors that
Mhm.
are not on the call. Her name is Jenny, WOLFENBAR. What?
Okay.
You want me to email it?
Can you text message it to me?
Okay, let me share her contact. Hold on. Okay.
So she is your she represent your billing company?
No,
No,
she's
she's at Oral DNA, and she's a
no, she's
contact
not
with
oral
Christian.
DNA. She's carry free.
Saliva. Carry free.
Carry
carry-
free.
Carry
Can,
free.
can you give me your email, your text message again, so
Okay.
I can send this to you?
Okay. 609
Wait a
two
minute. 609. Wait a
two
minute.
285
285.
7388.
I got it. 7388.
You have it. You have in your contact. Maybe
know.
you're not aware
I
of it.
know, but I never remember.
Okay.
609 285 74. I see
No,
I made
7388.
7388.
I can say hello to you again. All right.
No, I have it. It just didn't. So tell me if you got it. No.
No.
What am I
Right.
doing wrong here?
Or you can send me email later.
Okay, but let me just give the phone number to you. You guys can't call her until Monday.
Oh yeah,
anyway.
yeah, you can give
So
out.
I'll send it to you and you can put it in the whole email. Just let her know I'm sending you so she could send you the free gift.
Sure. Yeah.
The free gift is a book that explains all about the saliva and the testing and all of it. So I love it because it gives you so much information, and then you could have your team read it, your hygienist, which is very important that they know too. So I will send you this. And I have a person for oral DNA that I could send you. If you wanted to do a webinar with them, I could set that up.
Sure.
All right.
Does anybody want another webinar about this topic?
Yes.
Okay. We can set up another one for next
Okay.
weekend.
So
Thank you.
you're welcome. I mean, I can't do next Saturday, but I can do maybe another day. I don't even know. I have to look at my calendar, but I could tell you if I contacted Diane for you or send you her name, I'm sure she'll do the webinar for your group. I'll just send her an email introducing you.
Sure. Thank you.
Okay? And Jenny, both of them. I think it's going to be more informative if they do it because they're the experts at it and they work at those companies and they're very talented people.
Okay,
And
great.
you don't have to buy anything to learn either. So,
Great. Great.
And
Thanks.
the other company that I'm going to send you that everybody should get is the risk assessment. It's free because if you're doing dental billing, guys, every doctor here, you have the ability to be billing 4 hygiene visits a year on many of your patients for scaling, root planing, perio maintenance, and you should be selling the products in your office.
What product?
Yeah, when you get the samples, you'll see what I'm saying. I want you to see, I want you to learn from the best people in this field.
Great,
Um,
thank you.
Because honestly, we are a medical doctor. I have a mentor, just so everybody knows. My mentor is from Harvard. He was the dean of Harvard Medical and Dental School. He started the first interactive program in Harvard when the dental students came in as new students. They didn't work in the dental school, they worked in the medical. For 2 years, they learned how to diagnose, they learned how to document, they learned how to do everything a medical office does. They made collaborative, exclusive connections to the medical world. When they got to the dental school the first year and they went into to treat people, the professors were saying, no, you can't do that. And they're saying, yes, we can. No, you don't need to do that. Well, guess what? I had to go teach the professors, not the student, because the professors didn't know about all these things because they were never taught it. So they were so far behind the students that they looked like fools almost. And that is the truth. And he is now 82 years old. And he calls me up and he says to me, you're the only person I could trust with this, my legacy. I said, don't say that. You're not going anywhere yet. He said, well, if I do, you're in charge. He's been petitioning Washington, D.C. to have our names changed to oral physicians.
Is
Because
he one of the
people do
senators?
not perceive us as dentists. It's going to be up to you and your team to make people see you as a medical doctor.
Yep.
That's the change that's harder to make than the treating. You know how to treat patients, but you got to change who you are in their minds. You're not a drill and fill doctor. You're not that. You're a surgeon who could help restore them back to function and the ability to chew and swallow and all of those things. And that is a gift that patients need, but they don't look at us as medical doctors. So that's why collaborating with a medical doctor is going to put you in a different light. And you have to talk to them with those pictures that I show you, the full body pictures with all the connections to the body. Let them
Can I
understand
ask a question?
you're treating their body.
Okay, we have a
Can I
question.
have a question?
Yeah.
Christian, can I ask you a question regarding billing medical is all about documentation.
Yeah.
And it's all about demonstrating medical necessity. So in your documentation, when you write your SOAP note, you have to connect the patient's medical condition to the treatment that you're currently, the diagnosis that you have for this patient.
Yeah.
Do you have a source of publications
I'm gonna
or
show you one right
something
now.
we can go to connect the oral condition to the medical condition? Any documentation or magazine or a source of information that we can go fall back to?
I want to show you something, okay? Before we hang up. Hold on. Oh, I shut Zoom. Oh my God. Okay. What could I do? What I'll do is I'm going to send it to you, how to put a claim form together. Not a claim form, the SOAP note from the patient's medical history, and then adding our dental information so that you could see it. And I do have a membership, and I do have a newsletter that goes out all the time, and I have webinars, and I'm always doing something. But for instance, if you want to do your own billing or you want to learn how to do so, I teach that because that is so important. But I'm going to send one example of a patient's medical history that I just helped a doctor put together for her patient that I'm training her. I'm actually in the middle of training her. And I'm going to show you what we wrote, given looking at all her doctor paperwork and all her medical paperwork in the office, and then what we're doing. So you could see how I did it. All right.
Yeah.
But
Appreciate
go
your
to my
time.
website. I have a lot of information there that's actually like you could download stuff. And you have my website, the dental medical
What is your website?
dentalmedicalbilling.com. I'm putting this on there tonight, and you can take a look at it tomorrow.
Maybe Nina can post in the chat.
Yep, I
the
will put
website?
it in the chat for website.
Okay. So, I mean, I have a lot of stuff there, and you're going to have my email, you're going to have my phone number. So, don't sit by and say, let me not call her because I'm offering it. So don't,
Yep.
if I'm
Christian,
not here, if I'm teaching, I don't answer my phone. The service will answer it, but I get back to you.
I know you're busy.
I mean, you know that you tried to get me.
Yeah,
I'm in the middle
really
of
want to get hold of you.
I know, but if I'm teaching, like I'm telling you, I'm home this week.
Okay.
Okay. But if I'm not home, that means I'm working and I can't answer my phone if I'm in the middle of, like I was at the Endo Society. I
Mhm.
can't answer my phone.
I know
Then
you.
people stop me and ask me 1,000 questions. By the time I get back to my room, I'm exhausted.
I know. You're all over the country.
I'm all over the country. So, it's almost over because it stops for a while in the summer, although I just got hired for Virginia in June, but I try not to work over the summer. I try to take off,
You
except
really
for
need to
teaching.
take some break.
Okay?
Yeah. Christian, before I let you go, I have one more question. You mentioned your mentor. Could you please give me his name? The Dana
Yes. It's
Hoffer.
Dr. Giddon, Giddon, Donald Giddon.
Great.
And he's wrote many, many articles in Harvard.
We're gonna look into it.
Yeah, you could look at him online. He's got a lot of information up there. And
Cool.
he's just a really amazing man. Can you
Okay.
imagine he's still worried about this at 80? Yeah.
I'm pretty sure because it's really a mindset paradigm shift.
Yeah. It is a big shift.
Yep.
And we don't want to be left behind because we didn't graduate with it. So it's up to us to make this change. Where
Yep.
the young students are graduating with it.
Yeah, the magic one lies in every dentist's hand to wield your power.
Right. And they have so much talent and they could save lives. Think about a pregnant woman coming to your office who has an oral infection. If you look up at Case Western, write this down, everybody. Case Western, Dr. Yip was a bacterial doctor there. This pregnant girl gave birth early. It was a stillborn baby. She did a saliva test and a test from the placenta and matched the strain of bacteria 100%.
Wow.
That's how we know pregnant women need so much work.
Wow.
Yeah. So like these people are amazing and they are changing our world.
Changing the industry.
Yeah. So we have no choice but to get up and do it and
Yep.
make the change, but make your patient see the change. Show pictures.
Right. So first of all, we change our mindset, and then our patients and the society will.
Right. And it's like anything else. Like coding has to be learned at least twice a year.
Okay.
Okay? So it's not something that you could learn and never study again. It's just like the science. It changes
Ever-changing.
towards the science. So we have no choice but to keep up.
Yep.
I love it. So it's easy for me, honestly.
Yeah.
enjoy reading about it. But I will send you an email now with
Then
everything in it. And I
yep,
wanted to have all
okay,
all the
I'm gonna follow
doctors.
up with the questions from our doctors. Does anybody have any questions before we let Christine go?
Oh, Christine, do you have any resources for us to help with writing self notes? Remember earlier I asked the
Yeah, I'll
question
send
about.
you I'll send her the form that you can use. Just make sure all the answers are there, and then that becomes your soap note. But whatever the front desk does on that first phone call, it has to go in your clinical notes. It is a law today that the phone call is the first connection to your office. Those notes belong in the patient's chart because they're telling you why they're coming into the office.
I think I'm more specifically asked for in our soap note, for example, in the pre-op or surgery soap note, to connect the patient's medical condition to the necessity of the dental treatment that we're performing in our office.
Right.
Do you have any help to for us to document that part?
Yes, and I'm gonna put up an example for you guys,
Mhm,
okay? So I'll send it. Just give me an hour tomorrow to get all of it together, and I will send it. And if you have any questions when you get it, then next week you could pick up the phone and give me a call. Okay?
Sounds good. Thank you.
All right,
And I'm gonna
Christine.
send where I'm gonna be in this next meeting. So if you're in that area by Washington State, maybe we could, like I'll meet you after the meeting. You could come to my courses and then I can sit with you a little bit over a cocktail. So
That sounds fun.
not only will we learn from each other, but we'll actually make friends. How's that?
Sounds good. Sounds good.
Okay. Good night, everybody.
Good night.
Thank
Appreciate
you very much.
all your time.
You're welcome.
You're very
I'll make
sharing.
sure
Thank
you have
you.
everything tomorrow,
Thank you.
including
Good night.
the people that you
Thanks.
can make webinars with. Okay,
Yeah.
bye.
Show me
Bye-bye.
email. Bye.
Bye-bye.
Good night.
那个你让
好像思维就是说，
哎，彭医生。
思维是说他